Hi, my name is Cheryl Harris, and I was delighted to be invited to present this article for the Nutrition Corner of IBD Club. The article I chose is the Crohn's disease exclusion diet for induction and maintenance of remission in adults with mild to moderate Crohn's disease, an open-label pilot randomized trial. There's been long-term interest in potential dietary options to address IBD. Of them, the most promising is EEN, or Exclusive Enteral Nutrition for Crohn's. EEN involves having formula, just formula, for 6 to 8 weeks. This has been shown to decrease inflammation, increase mucosal healing, and can induce remission with 75% or more efficacy. There are a range of cons in that it is generally effective in pediatric studies in people who are newly diagnosed and is difficult from a social, emotional, and logistical perspective, and the benefit is generally not maintained once food is reintroduced. Prior studies have successfully tried to combine partial enteral nutrition, or PEN, with a whole foods diet known as the CDED, with success in the pediatric population. The Crohn's disease exclusion diet is an elimination diet that removes animal fat, wheat, red meats, emulsifiers, maltodextrin, carrageenan, and more. There's more detail provided in the article cited below from 2019. It requires specific fruits and vegetables as sources of pectin and resistant starch. It also requires chicken breast and eggs as sources of protein. There are 3 phases, with the first phase being the most restrictive, and it gradually reintroduces a range of foods in the following phases. The aim of the study was to assess the impact of the CDED on adults with mild to moderate Crohn's, both with and without PEN, and the primary outcome was clinical remission at week 6. The secondary outcomes were the percentage of patients in steroid-free remission at various endpoints, and the impact on CRP and fecal calprotectin. They also looked at endoscopic remission at the end of the study, and differences in remission between CDED alone and CDED with PEN. They also looked at differences in compliance between the 2 arms. This study included adults who have never taken biologics, who are 18 to 55 years old, who have mild to moderate Crohn's, who have ileal or limited ileocecal Crohn's, who have active disease based on colonoscopy, or who have an elevated CRP or fecal calprotectin, and who have Crohn's for 5 years or less. They excluded people with stricturing disease or previous resection, a dose change in the past 8 weeks, systemic steroids, current or past biologic use, women who are pregnant or breastfeeding, people with C. diff or parasites, or vegetarians who are unwilling to consume animal protein. 91 patients were assessed for eligibility and 44 were randomly assigned. There were 19 in the intention to treat group for the CDED plus PEN and 21 in the intention to treat group for the CDED alone. There were some patients who discontinued the study early for both groups, but there were more who discontinued early for the CDED group. The CDED involves multiple phases with diet liberalization at each phase. The CDED plus PEN involves consumption of 1,000 calories of a formula called modulin in the first phase and 600 calories of modulin in the second phase. The third phase does not require formula. And the results. For the intention to treat analysis, 68% were in clinical remission in the CDED plus PEN group, which was 13 out of 19. 57% were for the CDED group, which was 12 out of 21. Clinical remission was defined as a Harvey-Bradshaw of less than 5. 63% were in sustained clinical remission at week 24 in the CDED plus PEN group as compared to 38% of the CDED group. 42%, or 8 out of 19, were in endoscopic remission at week 24 for the CDED plus PEN group. It was 29%, or 6 out of 21, for the CDED group. So bottom line, are these protocols effective? For inducing clinical remission, probably. For endoscopic remission, that's more of a maybe, and more so for the CDED plus PEN group. Both groups lowered CRP and fecal calprotectin, and at week 24, 63% were in sustained remission for the CDED plus PEN group, and 38% were for the CDED alone group. The differences between the 2 groups weren't statistically significant, but this is a small and underpowered study. There was a trend toward better outcomes in the CDED plus PEN group. There are a range of limitations to this study. It's small, it's underpowered, there's no control group, there's no information provided regarding ethnicity or race. It's limited to certain types of Crohn's, to people without exposure to biologics, and to people with Crohn's for less than 5 years. There's also a question of generalizability because it's only done within Israel. However, it's a fascinating hypothesis, and I look forward to seeing larger studies in the future. Thank you so much for listening to this presentation.